Okay, I'd like to welcome you all today to this awesome half-off health that we're going to have. I know that so many times our patients ask me, what vitamins do I take, Dr. Bob? And do I want to take this? People bring in baskets of supplements, and they look at me, well, which one of these should I take? And I'm taking all these supplements, how come I don't feel good? Well, probably the supplements you're taking, first, aren't for you, and it's possibly that the supplements themselves might not be the very best supplements on the whole planet. So, going into a drugstore, department store, and buying supplements might not be the answer for you. So I have a whole bunch of nuggets we're going to talk about today. First statement I like to say is, what supplements should I take, and do you need them? You really don't want to just go to a health food store and just start taking vitamins because you read an article in a magazine, or you're at the bowling alley and somebody said, well, I took this and I feel better now. It's not about that. It's about trying to find out specifically what you could use for yourself. My goal, as you know, because you've been to these half-off health so many times, is for you to eat the right food. Because let food be your medicine and let medicine be your food. Believe it or not, I don't take a lot of supplements that are specific for nutrients like vitamin A and vitamin C and vitamin B. I eat those supplements. I focus the nutrition I take on supporting the organs in my body through either what we call nucleoproteins, and I work really, really hard on cleansing my body out. What's the difference between a synthetic vitamin and a whole food vitamin? Synthetic vitamins, when they process food, that word processing is really an unusual word. So when they process food, they're taking life out. You hear what I just said? When they process something, they're taking life out. You need the living part for your body to be functional. To give you an example, one orange has about 25 milligrams of vitamin C in it. One orange. So most of us have been led to believe that we need to take 500,000 milligrams of vitamin C a day. If you don't do that, you're going to die. Well, you know how big that orange would have to be? Or do you know how big a real whole food vitamin would have to be for that to work for you? So just as a side note, we'll talk about these in the notes. I encourage our patients and you all to take and eat red bell peppers, yellow bell peppers, orange bell peppers. Bell peppers are a great source of vitamin C. So in our practice, one of the areas that we like to focus on, especially when you get to week 15, is we have to fill out a symptom survey form and a diet sheet. You see, that tells me what's going on inside of your body. And we can talk about, there's a nervous system called the sympathetic nervous system. It speeds your body up. Well, if your sympathetic nervous system or your adrenal gland is really, really weak, you might need potassium. Well, what we have found in our practice, the best source of potassium is not necessarily bananas, because bananas will always cause your neck to hurt on the left side. I'd rather have you eat cucumbers. Great source of potassium, okay? We also do hair analysis in the practice. Now, I have learned so much from hair analysis. Now, just listen to what I'm going to say to you now. This is so significant. Somebody can come into the office and have low zinc. You don't necessarily need to take a zinc supplement. Hear what I just said? Someone can come in and have low zinc, but you don't necessarily need a zinc supplement. You might need to stay away from wheat and soy, because wheat and soy will deplete your body of zinc. So when we do hair analysis on our patients, probably one of the most common findings I find today is people are low in zinc and high in copper. So then they start thinking, well, what foods have copper in them? It's not the copper. It's the low zinc. Well, what caused the low zinc? More than likely, wheat and soy. Does that make sense to you? So just because you have a body signal and somebody read this article and said you need that, doesn't necessarily mean that that is a particular item for you. So I had this nugget. Let food be your medicine, and let medicine be your food. Think about what you're eating before you eat it. Now, in the Bible, they talk about eating food from seeds, from seed-bearing plants. I would avoid genetically modified food. Start becoming label savvy. No GMO. Seedless grapes are genetically modified. Anything seedless is genetically modified. Hear what I just said? Anything seedless is genetically modified. You see, God did not make it to be seedless. You're supposed to reproduce after your own kind. That's really a significant nugget I just told you. I would avoid hybrid foods. A patient of mine one time brought me in a grapple, which was an apple that smelled and tasted like grapes. But I didn't eat it, I could smell it. Actually, it was so grape smelling, it was repulsive. Because see, when you ever take into your body's going to incorporate that. please try to avoid synthetic foods. Processed foods will deplete your body of nutrients, especially B vitamins. Sugar will deplete your body of B vitamins. Sugar will deplete your body of zinc. Sugar will deplete your body of calcium. Sugar will deplete your body of chromium. Sugar is an anti-nutrient. I'd rather you stay away from sugar than start taking vitamins. So be aware of that. And today they have sugar that's organic sugar, organically sourced sugar. You'll see that on foods because sugar could be quite toxic. So as I mentioned to you, a great source of vitamin C would be bell peppers. Vitamin A. Now, if you look at my skin and my face, just like the skin of your faces, if you have a lot of dry skin, you need more carrots in your body. I eat 4 or 5 baby carrots every day. Carrots are a great source of vitamin A. Carrots will take away those little vitreous floaters you have in front of your eyes. Carrots are very, very important. I had a gentleman today, true story, 32 years old, constipation, would never go away, he's taking medication for it, heard me speak, heard about Dr. Bob's ABCs, apple, beets, and carrots, started taking the beets, and guess what happened to him? He started having a bowel movement. So, was he deficient in a laxative? No. He needed some kind of fiber. So carrots are great. For whole foods, or for B vitamins, I would suggest whole grains. Okay, now I'm not talking about wheat necessarily. I'm talking about brown rice, and I'm talking about barley, and I'm talking about spelt, and I'm talking about millet and couscous. I really want to avoid wheat. Wheat can cause a lot of challenges in people. You can have digestive distress because of wheat. Now the big buzz today is vitamin D. We don't really encourage necessarily vitamin D here in the practice. Get a little bit of sunshine if you're able to catch a few rays here in northern Ohio. Cod liver oil, flax oil is great. We do have a couple bottles of vitamin D, but I don't want you to go out and just start taking vitamin D for the sake of it, because I'm going to tell you what, you're going to cause an imbalance in your body. It just happens to be the latest going on. You know, a year ago they were putting oil in everything, and a year before that they're putting calcium in everything, and a year before that they're putting antioxidants in everything, and before that. So there's always something going on. Don't focus on what's popular right now. Vitamin K from greens. I eat a mixed green salad every day. Mixed greens, not iceberg lettuce. Wheat germ is a great source of E. Now you can say, well, Dr. Bob, you told us not to eat wheat. Wheat germ capsules, we use a product line that has the wheat germ oil that comes from the company. I don't personally use wheat germ. I eat full whole grains. I don't worry about lack of a vitamin E. I do take a product called Cataplex E, which is a great source of selenium from a company called Standard Process. Probably one of the most significant items that you could use for your health is Celtic sea salt. Celtic sea salt is a great source of minerals. So I'm going to encourage all of you in this room, we have some Celtic sea salt here, we have it on our webpage. Celtic sea salt comes from the north of France. Use it liberally. It's a great mineral source. If you crave salt, craving salt is not wrong. Craving salt is telling me there is something wrong. Because see, people have this salt phobia today in America because their blood pressure is up. Well, they only found maybe 5% of blood pressure cases are caused from sodium. So we really encourage Celtic sea salt. Alfalfa is a great source of minerals. We have a product in our office that is sourced from alfalfa, alfalfa tablets. We also use trace minerals. We use a product called Mintran from Standard Process. If you crave salt, if bright light bothers your eyes, you may in fact need minerals, and I would try Celtic sea salt. How about calcium? Now, I've been practicing for 30 years, and what I have found from my experience is that most people don't need calcium. They have enough calcium in their body. What they really need is more iodine and more protein to mobilize the calcium. Now, if you have leg cramps at night are a sign that you're not using calcium properly. So what we have used and what we have done is we have a test called the leg tissue calcium test, where you could literally take the blood pressure of your leg. You put a blood pressure cuff on your leg and you pump it up. It should go to about 200. If it does not go up to 200, that means that your muscles in your body are starving for calcium. And I would encourage you to try to put an iodine tablet in your mouth and then pump it up and